Hey everyone, it's Josh here. I'm going to give you another update to my patellar realignment surgery recovery. Try to keep this pretty quick. So I am now officially 4 weeks out of my right knee patellar realignment surgery, and also the accompanying kneecap ligaments reconstructed on both sides as well, which have lots of fun technical names to them. And I am, as of within a couple of days, 6 months post-op for my left knee patellar realignment surgery recovery. So I'm going to kind of show you the condition my knees are in at this point and talk to you about the healing thus far. So I'll talk about the freshest one, the right knee. So my orthopedist mentioned this, and I think a lot of people that have dealt with this stuff know every knee, every body part heals differently in a surgery. My right knee was much stronger going into surgery than my left knee was. But as you can see, there's lots of swelling still at 4 weeks. A lot of now, just recently, the pain level has pretty much gone to a place where I could be fine without really doing anything long term. No ibuprofen, nothing else, and I'm not like writhing in pain anymore, and I can sleep pretty good. It took me, both knees, it took me to about 4 weeks. That 4 week mark post-op is where the pain level kind of subsided. The swelling is definitely not going down in my right knee as quick as my left knee. But my right knee has always kind of had that problem. As I've mentioned in prior videos, and if you're just tuning in for the first time, my reasoning for the patellar realignment surgeries is a little more serious. It wasn't like an injury or anything. It's an actual abnormality in my knees that I've had since I was a child, where my kneecap's easily dislocated. I've had countless dislocations and also subluxations, which is where they just pop in and go back out, but it's still no fun. And so in the last decade, they've really mastered this patellar realignment surgery that's offered, and that's why I finally got this done, and it's helped. It's supposed to help a tremendous amount with the stability of my kneecaps and hopefully be the cure to this problem that I've had forever. And I'm really confident it is. So as far as right knee goes, a lot of swelling still, but I can already tell it's a lot stronger than my left one. When I went in for my left knee surgery, throughout basically the entire 6 week base healing process, I couldn't do I've been instructed by my orthopedist both times to do leg lifts as I can after the second week. I could barely do leg lifts at all with my left leg, but I can do countless leg lifts in my knee brace with my right knee. So it's already showing signs of having tremendous more strength than my left one. So it should bounce back pretty good. You can also tell when you were looking at it that I have a lot of my atrophy in my muscles. Again, I was expecting that. It's disappointing. I worked pretty hard to get a little bit of size on my legs over the last year, at least my right leg. But it was really to build up strength for the surgery to make my healing better, and also after recovery, be able to really build up as well. If you've been following the videos and you notice my left leg is still really skinny. And it's going to be like that for 12 to 18 more months as I really work out hard. But if you can note, there is a little bit of muscle starting to form back up in my quadricep. Not much, a little, but when you're tracking it like this, you take the little victories. So about my left knee healing, 6 months out now, it's going great. I love it. I do a leg workout twice a week, and I do a pretty rigorous hypertrophy one to start building muscle in it. And like today was leg day at the gym, so I did single leg press, and for the first time I hit 130 pounds, and I was able to do a set of 1 with that. And then I do hypertrophic sets backwards, which is just basically to failure sets of 6 to 8 until I really wear out the muscle tissue. That's how you get the growth and the strength and the size. I also do leg extensions, single leg extensions, and I did that up to 50 pounds. I'm sorry, 45 pounds I did today. And I did 6 sets of 8 to 10 reps with that weight, which is amazing. Before I had this surgery, for my entire life, I've never been able to do leg extensions because my knee wouldn't do that motion. If it was trying to extend with a little bit of weight, my kneecap would just pop out. And that doesn't happen at all anymore. So that in its own is an amazing improvement in my general health. So I know a lot of people think and say after you have major knee surgeries that you're never going to be perfect and you're never going to be better than you were. I kind of see what they say because there's a lot of work going on in there, but at the same time, like in my case, I could very well be better than I've ever been, and I think a lot of people can be a lot better than they've ever been. It's about the focus you put on it. I mean, if you never you didn't work out a lot and you just had basic level strength and you went in for a surgery, and after that you work out a lot and really work on muscle building and things like that, I think you can do a lot of amazing things. And I think a lot of it's more mind than it is anything else. And the dedication and follow through on what the physical therapist tells you and what your orthopedist tells you, and just making sure the right things happen. Like I said, left knee is healing amazingly. I've been using scar reduction cream to try to minimize the scar and have it get reduced. I had a prior surgery on my left knee where the same scar was here, so the knots and stuff in the scar are pretty much the same as they were then. My right knee, I've never had a surgery to this degree on my right knee, just orthoscopics. So I'm going to early on do scar treatment to try to reduce that, and that's just an aesthetic thing. And if you're going through this thing, the scar treatment stuff, there's some great stuff. Silicone, it's just a silicone product, but it can help really eliminate, help reduce scar tissue and the look of scar tissue on your skin if you started off pretty early on. You got to wait till the scar is obviously completely healed from the surgery, but after that you can start applying it early on, and then the softer scar tissue will break up faster and be less predominant. As far as my right knee goes, I'm also doing passive range of motion exercises. So just like I did with my left knee, 10 knee bends a night, assisted. I can't put any pressure on, I can't extend my leg. It's got to be assisted, no leg engagement, passive range of motion knee bends. I'm getting to about 90 degrees, which is pretty impressive because I wasn't able to get to my left leg until after the 6 to 8 weeks of healing. So again, that's I was preparing for this surgery. I worked out a lot. I did a lot of stretching, and I'm thinking it really paid off in a lot of ways. So 2 more weeks of wearing the immobilizing brace to 6 weeks, and then I'll start physical therapy to start building strength and getting dexterity and getting the extra piece of encouragement. To those of you going through this that are questioning whether or not to do physical therapy, do it. I don't care who you are. I don't care how much you know about physiology, or if you're a big workout enthusiast yourself, or you bike a lot. There's something about going and seeing someone else and holding that accountability on you and encouraging you to push yourself just a little further than maybe you push yourself, that will get you over those hurdles. That's one of the biggest things about physical therapy. Plus those therapists are extremely well trained in anatomy, and they understand some of the muscle kinetics and things like that we don't understand even on a high level knowledge of physiology. So it's good to have their opinion, and it just helps with healing. And I just can't speak highly enough to that. It's so important, and you got to do it. And that's the process I followed. So that's the right knee, that's the left knee. I will post another video in another 2 weeks when I get the brace off and I'm allowed to do some things. But anyone else going through this, I wish you the best of luck, and feel free to stay tuned for more videos. Thanks.